Chapter 20A Oncology Neoplasms. Neoplasms. A neoplasm is a normal new growth of tissue. Malignant neoplasms cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patient, doctor usually says growth or tumor. You have a small growth tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there are the other causes such as inflammation or fluid accumulation. Patient say, Patients say, I have a lump in my left breast. Doctors say there was a firm palpable mass in the liver. Malignant tumor or characterized by rapid growth and invasiveness. The tumor may invade local tissue or may spread to distant parts of the body. Metastasis. Neoplasms, which are the result or metastases, are called secondaries of opposed to the original tumor, which is the primary. We have the result of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage and there is no sign of spread. So if we remove it, there is every chance of a complete cure. Note: to invade virus is to enter and spread throughout a part of the body, and this process in invasion now. If a tumor is described as invasive, it has the ability to spread. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a pace occupying lesion in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumor of the colon may block the lumen and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. A 33 years old man presented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kilograms in weight. He was also complaining of night sweats. He had no significant past medical history. Treatment of tumors. A tumor can sometimes be completely removed of excite by surgery. If this is not possible, for example, if it has already 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 metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. See you or therapy. See Unit 42. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Complete the table with words from A, B, and C opposite and related forms. Bears Noun, adjective. Cure, curative. Excise, excision. Grow, growth, growing. Invade, invasion, invasive. Obstruct, obstruction, obstructive. Pi, palliate, palliation, palliation, palliative. Palpate, palpation, palpable. Spread, spread, spreading. Swell, swelling, swelling, swelling. The notes below are about the patient described in the opposite. Use them to put the sentences 1 to 9 in the correct order to make the next paragraph of the case report. Use appendix 2 on page 20 if you need help with the abbreviation. Abbreviation. Um, On examination, his temperature was 37.8 degrees Celsius. There was a smooth form 3 by 4 cm mass in the right supraclavicular fossa. There were enlarged lymph nodes in both axillary and in ignored areas. His mouth and throat were normal. His pulse rate was 100 per minute, and blood pressure 112 over 66. His cardiovascular and respiratory system were normal. Um, um, Abdomen examination, there was a mass palpable 3 cm below the left costal margin. Examination examination of the central nervous system was normal. Complete the sentences. Look at A, B, and C opposite to help you. 1. Distant spread of tumor cells is known as metastasis. 2. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. 3. The opposite of painful is painless. 4. A malignant neoplasm is called a cancer. 5. Tumors which do not invade or metastasize are benign. 6. Secondary tumors are those which result from the spread of a primary. 7. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Over to you. Over to you. The most likely clinical diagnosis is the patient. Describe it in the opposite and 28.2 above. Is lymphoma? How would you explain his condition to him? It looks likely that you have lymphoma, a cancer of the lymph glands. This can cause painless limbs, weight loss, and night sweats. The next step is to do tests to confirm it, find the exact type. Lymphoma usually has good treatment option and will get you through each step. Now, in Spanish. Oncología. Neoplasias. Una neoplasia es un nuevo crecimiento normal de tejido. Las neoplasias malignas, cánceres, tienden a propagarse y causar enfermedades graves o la muerte. Las neoplasias benignas no se propagan y son menos dañinas. Al hablar con los pacientes, los médicos generalmente dicen crecimiento o tumor. Tienen un pequeño crecimiento tumoral en el intestino. Un bulto o hinchazón es una acumulación de tejido o líquido que es visible o palpable. Se puede palpar o sentir con los dedos. Un bulto puede deberse a una neoplasia, pero existen otras causas como la inflamación o la acumulación de líquido. Los pacientes dicen, tengo un bulto en la mama izquierda. Los médicos dicen, había una masa firme y palpable en el hígado. Los tumores malignos se caracterizan por un rápido crecimiento y capacidad invasiva. El tumor puede invadir tejidos locales o extenderse a partes distantes del cuerpo, metástasis. Las neoplasias, que son el resultado de la metástasis, se denominan secundarias, a diferencia del tumor original, que es el primario. Ya tenemos los resultados de la exploración y me temo que muestran que tiene un pequeño crecimiento en la próstata. Afortunadamente parece estar en una etapa temprana y no hay signos de propagación. Por lo tanto, si le extirpamos, hay muchas posibilidades de una curación completa. Nota. Invadir, verbo, es entrar y extenderse por una parte del cuerpo y este proceso es invasión, sustantivo. Si un tumor se describe como invasivo, tiene la capacidad de propagarse. Síntomas y signos de malignidad. Los síntomas de una enfermedad maligna pueden estar relacionados con el tamaño y la ubicación del tumor. Por ejemplo, una lesión ocupante de espacio en el cerebro provoca un aumento de la presión intracraneal y síntomas como dolor de cabeza, vómitos o alteraciones visuales. Los tumores de colon pueden obstruir, bloquear a la luz y causar cambios en el hábito intestinal. Otros posibles síntomas de malignidad incluyen sangrado, dolor y pérdida de peso. Caso 55. Un hombre de 33 años acudió a su médico de cabecera quejándose de un bulto indoloro en el lado derecho del cuello que había estado presente durante unos 2 meses y que estaba aumentando de tamaño. Se había sentido mal en general y había perdido unos 5 kilogramos de peso. También se quejaba de sudores nocturnos. No tenía antecedentes médicos significativos. Tratamientos de tumores. A veces un tumor se puede extirpar por completo o extirpar mediante cirugía. Si esto no es posible, por ejemplo, si ya ha hecho metástasis en otras partes del cuerpo, se puede destruir mediante radioterapia o quimioterapia. Cuando no es posible la cura, se administra un tratamiento paliativo cuyo único objetivo es aliviar los síntomas. Gracias.